Rooibos tea offers benefits for kidney health which can prevent chronic kidney disease. Here are a few ways in which Rooibos tea may be beneficial for the kidneys. Caffeine-free. Rooibos tea is naturally caffeine-free. For individuals with kidney issues, reducing or eliminating caffeine intake is often recommended. Caffeine can have diuretic effects, potentially impacting fluid balance in the body, and reducing caffeine intake may be beneficial for those with kidney concerns. In individuals with kidney concerns or conditions such as chronic kidney disease, CKD, managing fluid balance is crucial. Excessive caffeine intake can potentially exacerbate dehydration, which may not be ideal for kidney health. Hydration. Support. Adequate hydration is essential for overall health and is particularly important for kidney function. The kidneys play a key role in maintaining fluid balance in the body. Since Rooibos tea is caffeine-free, it can contribute to daily fluid intake without the potential diuretic effects associated with caffeinated beverages. Staying well hydrated is generally recommended for kidney health, as it helps the kidneys filter waste products and maintain electrolyte balance. Low in oxalic acid. Rooibos tea is free of oxalic acid, which is found in some teas and can contribute to the formation of kidney stones in susceptible individuals. Choosing beverages that are low in oxalic acid may be part of a kidney-friendly diet. Oxalic acid in tea. Oxalic acid is a naturally occurring compound found in various foods and beverages, including some types of tea. In the context of kidney health, oxalic acid is noteworthy because it can contribute to the formation of kidney stones. Kidney stones are hard deposits that can form in the kidneys when certain substances, such as oxalate and calcium, accumulate and crystallize. The chemical formula for oxalic acid is TOH2 or C2H2O4. Oxalic acid is found in many plant-based foods, including leafy greens, vegetables, fruits, and nuts. Some examples of foods with relatively high oxalic acid content include spinach, beets, rhubarb, and certain berries. Calcium oxalate. In the human body, oxalic acid can combine with minerals, particularly calcium, to form crystals called calcium oxalate. These crystals can contribute to the formation of kidney stones in individuals who are prone to this condition. Excessive consumption of foods high in oxalic acid, coupled with factors like dehydration or a predisposition to kidney stone formation, can increase the risk of developing kidney stones. However, it's important to note that not everyone who consumes oxalic acid-rich foods will develop kidney stones. While kidney stones are a concern for some individuals, oxalic acid also has potential health benefits. It can act as an antioxidant and may play a role in protecting plants from herbivores and pathogens. Cooking, boiling, or other forms of food processing can reduce the oxalic acid content in certain foods. For example, boiling spinach can help lower its oxalic acid content. Individual variability. Individuals vary in their ability to absorb and metabolize oxalic acid. Some people may be more sensitive to oxalates and may need to moderate their intake, especially if they have a history of kidney stones or other related conditions. Role of oxalate in kidney stones. Oxalate, a component of oxalic acid, can combine with calcium in the urine to form crystals. These crystals can then aggregate and develop into kidney stones. Certain types of tea, especially black tea, may contain relatively higher levels of oxalic acid compared to Rooibos tea. Rooibos tea and low oxalic acid. Rooibos tea is naturally low in oxalic acid. This characteristic makes it a favorable choice for individuals who want to minimize their oxalate intake, or those who are advised to follow a low oxalate diet for kidney stone prevention. Choosing beverages like Rooibos tea that are low in oxalic acid may help reduce the risk of oxalate-related kidney stone formation. Kidney stone prevention. For individuals with a history of kidney stones or those prone to forming them, healthcare professionals may recommend dietary modifications, including a reduction in oxalate intake. Rooibos tea can be included as part of a kidney-friendly diet, providing a flavorful and caffeine-free option that aligns with a low oxalate approach. Individual considerations. It's important to note that the impact of oxalate on kidney stone formation can vary among individuals. Some people may be more sensitive to dietary oxalate, while others may not be significantly affected. Dietary recommendations, including oxalate intake, should be personalized based on individual health conditions and factors. It's advisable to consult with a healthcare professional or a registered dietitian for tailored advice. Rooibos tea is low in tannins. Tannins are naturally occurring compounds that can be found in certain foods and beverages, including tea. They have astringent properties, and can bind to minerals like iron and calcium, forming complexes that may be less absorbable in the digestive system. In the case of kidney health, excessive intake of tannins may be a concern for some individuals. Tannins can potentially interfere with the absorption of certain minerals, and excessive consumption may contribute to mineral deficiencies over time. For example, tannins can bind to non-heme iron, the type of iron found in plant-based foods, potentially reducing its absorption. Rooibos tea is known to have a low tannin content compared to traditional teas like black tea. The reduced tannin levels in rooibos tea make it less likely to interfere with the absorption of minerals. This could be particularly relevant for individuals who are concerned about their mineral intake or those with conditions that may be affected by mineral absorption. Antioxidant content. Rooibos tea contains antioxidants, such as quercetin and asparlathin, which may have anti-inflammatory and antioxidant properties. Reducing inflammation and oxidative stress could potentially have positive effects on kidney health. Quercetin and asparlathin content. Rooibos tea is rich in antioxidants, including quercetin and asparlathin. These antioxidants have been studied for their potential health benefits, including their ability to neutralize free radicals in the body. Free radicals are unstable molecules that can cause oxidative stress, potentially leading to cellular damage. Antioxidants help counteract the harmful effects of free radicals. Reducing oxidative stress. The kidneys, like other organs, are susceptible to oxidative stress. Factors such as inflammation, certain medical conditions, and environmental exposures can contribute to oxidative damage in kidney tissues. Antioxidants in rooibos tea may help mitigate oxidative stress in the kidneys, offering protection against potential damage. Anti-inflammatory properties. Chronic inflammation is associated with various kidney conditions, including chronic kidney disease, CKD. Rooibos tea contains antioxidants with anti-inflammatory properties that may help reduce inflammation in the body. By supporting an anti-inflammatory environment, rooibos tea may contribute to kidney health and potentially reduce the risk of inflammatory-related kidney issues. Protecting cellular health. Antioxidants play a role in protecting cellular health by preventing or minimizing damage to cells. This protection is crucial for maintaining the normal functioning of the kidneys. Rooibos tea's antioxidant content may contribute to cellular protection, supporting the overall well-being of kidney tissues. Potential renal protective effects. Some studies suggest that certain antioxidants, including those found in rooibos tea, may have renal protective effects. While more research is needed, these effects could include preserving kidney function and preventing damage. Complementary approach to kidney health. Including antioxidant-rich foods and beverages like rooibos tea as part of a balanced diet can be a complementary approach to supporting kidney health. It's important to note that while antioxidants are beneficial, they are just one aspect of a holistic approach to maintaining kidney health, which also involves lifestyle factors, hydration, and a well-balanced diet. If you are taking any medications or have existing health conditions, it's crucial to consider potential interactions. While rooibos tea is generally safe, it's always a good idea to check with your healthcare provider, especially if you have concerns about how certain compounds in the tea might interact with your medications. Iron absorption. Rooibos tea contains compounds that may inhibit the absorption of non-heme iron, the type of iron found in plant-based foods. If you're taking iron supplements or have an iron deficiency, consuming large amounts of rooibos tea around mealtime may interfere with iron absorption. Liver enzymes. Some compounds in rooibos tea may influence liver enzymes involved in drug metabolism. If you are taking medications that are metabolized in the liver, there is a potential for interactions. It's crucial to consult with your healthcare provider to ensure that rooibos tea does not interfere with the effectiveness of your medications. Drug sensitivity. Certain individuals may be more sensitive to the effects of certain compounds in herbal teas, including rooibos. If you have known allergies, sensitivities, or specific health conditions, it's advisable to discuss the consumption of rooibos tea with your healthcare provider. Pregnant or lactating individuals should exercise caution with herbal teas, including rooibos. While it's generally considered safe, it's advisable to consult with a healthcare professional before incorporating it into your routine. If you found this video educational, please click the like button and subscribe to the channel. Thank you for watching. We will see you next time.